Hi, everybody. I am Dr. Rebecca Griffith, the ED DPT. Welcome back to another episode of Admit It or Not, the ED DPT podcast. And just my regular disclaimer, it is summer here in the Griffith household, and there are 3 children running amok. Some are here and a dog behind my feet, and so this could be great, or it could turn into disaster quickly. I guess you'll have to watch the whole episode to find out how it ends. I am so excited to have my friend Dr. Mica Mitchell here with us today, and I'll let you introduce yourself.
Hello, same disclaimer. I have a dog right behind me as well, so we're going to hope for the best. My name is Mica Mitchell. I am a pediatric certified specialist in physical therapy. I am a mindfulness guide. I have ventured into this space of mindfulness and found how helpful it is for anybody in any setting, no matter what you do, just to be the person that you want to be the best version of yourself. And I also am in academia, so I teach different content in pediatrics, as well as other physical therapy courses. And I'm so excited to be here with you.
Well, I'm so excited to have you here. I feel like I've got my first celebrity guest. I'm super excited.
Stop. You are the celebrity.
So I think it's pretty obvious then, based on your background, that you are not an ED PT.
I'm not. And so that's where I'm like, I'm so honored to be invited to this, but I do suspect you invited me not necessarily for the peds content, but for the mindfulness.
Although that is an area I could use a tremendous amount of intervention, because if a child comes into the emergency department, I'm like, ooh, we need to get them back out of here, because these little people are not little people. They're like kids, and I'm not super prepared for that. And a kid recently who swallowed a quarter in their esophagus, and all of our docs were like, we gotta get this kid to the children's hospital. So definitely not my realm, but definitely not why you're here. You also probably have never worked in an emergency department, right?
I haven't had an opportunity or really know much about peds in the ED. So I would not be your person for that content. Well, but it's intriguing for sure.
For sure. And I think one of the things that I get asked a lot about working in the emergency department is it stressful? And I think that's a super valid question. And the answer is yes. And even if you are a very calm, chill, easygoing person, it's still stressful. And also, one of the things that I've learned in the emergency department is there are a variety of different coping mechanisms that people use. And those coping mechanisms, some are healthy and some are not. And I've also learned a huge no is that you never ask anybody who works in the emergency department, what's the worst thing you've ever seen? Because you're inviting that person to relive a traumatic experience for your benefit at a party.
Absolutely.
Or to satisfy your curiosity. And having seen how things have gone in the last few years during a pandemic, and the amount of traumatic events that I would say have come through the emergency department, and the scars that healthcare providers everywhere, especially in frontline, will keep with them from the pandemic, I have some concern about our mental health as a group, and also how to manage things so it doesn't become this load that's too heavy to carry. Yes. So one of the reasons that I asked you to join us today is because you are an expert in mindfulness. And for those who don't know what that is, can you dive into that a little bit?
Absolutely. And valid. I do believe I can shed some insight into the concerns that you have and that you've identified, what needs you've identified in your setting. And so mindfulness, what it's not is an empty head of let me rid myself of all thought and all things to be in a space of nothingness, right? Sometimes we think about meditation and people are like, I can't do that because there's just so much going on around me. And I think the beauty of mindfulness is really about being present in the moment. And that means whatever comes and goes, right? It's not that we're pushing it away. There's some things that we don't want to necessarily fester and stay, when it comes to negative thoughts or negative energies or tension or stress. But I think really understanding what mindfulness is, being present in the moment, non-judgmental. So that means, it is what it is. And so some of that, it once you practice mindfulness, it just kind of becomes who you are. And so where I live this. I live mindfulness every day, in different settings. And yes, it doesn't mean that everything is easy and it's all, wonderful. And sometimes I say my Twitter feed is rainbows and unicorns. Life is not always so bright and floral. It's to be able to also acknowledge, when things are tough, when you
Yeah.
see trauma, when you're in a moment that is just really overwhelming, you have the tools of mindfulness and strategies to give yourself that moment to really be present.
Right.
I think sometimes we want to just be like, oh, everything's okay. No, it's okay to say, what, I'm going to be really mindful and tell everything's not okay. And if you're my person, then I can really shed some light into that. And part of being mindful is being reflective and giving yourself the time and space to step back, either in that exact moment or maybe later on, and say, what was that? What happened? What's going on?
Mm-hmm.
And also want to say up front that mindfulness is not a replacement for any type of mental health services that are needed.
Fair.
And I think it's a beautiful pairing with whatever support you need from the medical community, from your local community, different programs or anything that's available. I think utilize and take advantage of those services, because all of that helps you become the better version of yourself in a holistic way, that it's not that we're ever denying the needs that we have.
I think you raised so many good points. And there are times in the emergency department where I don't want to be present, where I want to check out. And I don't want to witness the suffering in front of me. I don't want to be thinking about the hostility that has been brought to me, or I don't want to focus on the outcomes that the person in the room next door is having. Well, maybe that person's coding and I'm trying to help somebody in the next room with their low back pain.
Yeah.
And so there are times where it's ugly to be present and it's painful.
Wow.
And so is there any kind of mindfulness where you can sort of therapeutically not be present?
That is a great question. And I may have to dive a little bit deeper into some research for that, but I do believe yes. I think just the acknowledgement of this is too much.
Well, that was the perfect answer to that.
Because sometimes
I need a minute.
Yeah, sometimes we want to do all things and be all things. In our profession, we're physical therapists, we're helpers. In the medical field, we're helpers. So we want to help, we want to be there, we want to do all the things and act like we can handle all the things. And honestly, I'm sure I have not stepped foot in the ED in this capacity, but I'm pretty sure that at any given moment, there could be way too much going on at all different spaces. And, how do you just acknowledge and say, let me a second, take a breath and say, this is too much, and I think part of that is being honest in that moment, what it is that you're experiencing, and being honest with yourself. And when I said before about this reflection, knowing yourself, right? Part of mindfulness is being honest with who you are, being honest with what you can handle. And so that then also goes back to when you need to, if it's a conversation with your supervisor, in the moment, in emergencies, you can't always tap out, right? But to say, what, hey, I know who I am. I know that I can only handle this for so long that I need a break. I need whatever this outlet is. I need to separate myself from this. I need some support, and being okay with asking for that. I think I will speak for myself, some people, and I know myself, it's hard sometimes to ask for the help that you need. It's hard to say, what, I need a break. And I've said that for myself. And it was just a freeing experience to say, no, we cannot be always on the go, always there for everyone, and really not having that space for ourselves.
So from what I hear there is mindfulness isn't just an exercise. It's a way of thinking and a way of being. And I think for me, if I could learn to be perhaps more mindful of myself and be more present with how I'm feeling and how I am in a particular moment, that would probably also help me be a little bit more mindful as a clinician about what maybe my patients are experiencing.
Absolutely. And all of that, right? Because then once you are honest with what your experience is, then you can kind of meet them where they are, right? And so mindfulness is non-judgmental, being present. Sometimes that's what your patients need. They don't want to, how many times people have been harmed. You talk about trauma as an employee, as a healthcare provider, but our patients have been in traumatic healthcare experiences where people don't listen and people don't believe them, or they're drug seeking when no, they're here because of a crisis. If it's their sickle cell, if it's their back pain, like if we can sit in a non-judgmental space, and just sometimes just the listening is what this other human on the other side of us need. And so as a practitioner, let me bring myself down away from this air of judgment that maybe you've already experienced, or sometimes our patients come to us in they're in the ED. I'm pretty sure they're coming because they're in pain, or there's something really urgent that's driving them there,
or possibly they have no one else to help them,
and they're like, look, it's late and there's nowhere else for me to go, right? And so if you just come into a space, and I think maybe this is mindfulness, I believe it's mindfulness, but it's just about humanity, is really seeing the person in front of you as a being, right? As a human, that you share these similar experiences about love, joy, the seeking and the desires of life, and goals and things like that. And so I think that in itself, to help you to then relate to your patients, sometimes that helps to diffuse what's going on. It's not a guarantee, but it's one other something we can add to what it is that we bring within our profession.
Well, I think what you're talking about is therapeutic alliance, right? Like, absolutely. But how to do it better. And in the emergency department, we have to do that fast, right? Like, it's not like I have 6 sessions, like maybe the next time I'll ask you about your favorite fruit, and we'll bond over our love pineapple in the blender. Like, I need to, while you're in crisis
right now,
connect with you now. And I was on Be a Better PT podcast with Andrew Hammond, and one of the things we talked about is that connection and that ability to establish trust is therapeutic. And so mindfulness, what you're saying, is a strategy that we can use to establish therapeutic alliance, trust, and connection with our patients very quickly.
Absolutely. Because you kind of you're disarming yourself. And I think part of it too is, for it to be effective, you have to understand what your intentions around it are, right? What is it that, back to that, knowing yourself, knowing who you are and what you want, how do I want these individuals to perceive the help and the assistance that I'm bringing? If you want to be the person in the room that knows all the things and that is absolutely going to be the one to fix it, even with mindfulness, you're not going to be successful. But if you, if you bring that, kind of let ego go and say, this is a partnership. This is collaborative. This is, I may not be the solution, but at least I can listen and be present. And in that present awareness and that active listening, the solution may present itself, and it more than likely is going to come from your patient.
I think it's probably more efficient, right? If you're really mindfully, actively listening. Because I would say that some people in the emergency department would say, there's no time for that. Like, I need you to tell me in 2 minutes or less, like, why you're here and what the problem is. Now, as physical therapists in this setting, we have a lot more space and time to truly, like, be with our patients. But I think that what I run into so often is that when I receive a history from the patients, it's different than the 2 minute that they gave somebody before me, because I am trying to take that time to sit, be with the patient, establish trust, and hear what they're saying. So what strategies would you suggest that people implement before they go into a room, to check in with themselves and then to check in with their patient?
Yeah, there are so many mindfulness apps. There are social media links. You can follow me on social media just for some ideas of things that you can implement. And it doesn't have to take a lot of time, because I identify in life, you can never find the time, you got to make the time. But even in making the time, if you're still not even sure, you're like, I'm not sure about this mindfulness, I don't know. And if you want to just give it a try, you can start with 1 minute. You can start with 3 breaths. You can start with 10 seconds. Like, it doesn't have to be this massive time commitment of, I've got to go to all of these courses to really learn about it, right? At its core, it's being present, being aware, being non-judgmental, utilizing breath, and getting to know who you are as an individual. And so in 10 seconds, could you take, see what you get from yourself as just taking a deep breath in and a deep breath out. And sometimes that in itself, we don't do that. We are on the go, we're moving, we're shaking. And that deep inhale, if that's all you try, and then see what happens. And you're like, okay, you know what? I realized I was holding everything up here. That deep inhale will allow me an opportunity to just kind of release. Okay. Oxygenation, that helps, even if it's just for clarity, right? And so if you're like, okay, fine, this deep breath did a little something. Now what's next? Take a minute, right? And so you're like, 1 minute, what can a minute do? A minute is either a really short amount of time when you just think a minute out of like a day of 24 hours. But if you think of like, if you sit there for a minute and just put your timer on and let it go for a minute, that can seem like forever.
Yes.
I've done this where it's like, I'm just going to take 1 minute and I'm like, okay, it's got to be done, right? Why isn't that timer gone off? Oh, wow, that was only 30 seconds. Right?
Mindfulness and planking take forever with a 60-second timer. I think if you would like to pause time, for me, it's meditating and planking.
Yes, exactly. Right.
It's like
so
brain planking.
Things you do over time start to make the difference. Because for me, I didn't know what mindfulness was going to do for my life until I did it. And then that moment of reflection to step back and say, wait a minute, I feel like I'm not holding my tension, or life would happen and stressful things would happen. And I'm like, I would check in with myself and say, why is my stomach in knots? Like, why am I upset? And then I just kind of unravel my day, like, well, what happened? Oh, that conversation or this unexpected thing that popped up really kind of got me. And now I need to continue to take some deep breaths and just say, okay, that is the case. Like something new, something unexpected has occurred that I need to address that I wasn't planning on addressing. And now I have to come up with a plan. But like, if you never take those moments to check in with yourself, you don't even realize how life is impacting you.
Yeah, I think that the hardest part about what you've said is the non-judgmental part. And that feels like a skill. So, I mean, obviously, I think as humans, we have implicit biases and we make judgments all the time, right? Like my water is not quite cold enough, even though it's perfectly cold, or like, I feel like my hair looks a little weird. Like I'm judging myself, I'm judging my patient. If I talk to the nurse, maybe before I walk into a room and the nurse says to me, oh, they're just drug seeking, which has happened. I mean, it doesn't happen that often anymore. I feel like we've had a really great culture shift in emergency medicine in general. But when that other person puts judgment into your head before you even go into a room, I think it's hard to come back from that. And I think too, it's hard for patients to come back from that. Like if somebody walks into the room and says to them, like, we're not going to do anything for you, you're just drug seeking, then that patient's going to have a very hard time taking me from a beginning point. Just like I might have that same problem with them.
Absolutely.
And I'm also thinking too, like when I come out of a room, I can be very judgmental to myself about how something went. And then that I might carry into the next room with me. So how do I set down the judgment? Like truly, how do you set that down? Or do you just be aware of it?
That is a beautiful question. And those are great examples of how you then have to navigate this in as part of a lifestyle and the importance of checking in and reflecting. And so when you step back, you beautifully stated those experiences and seeing how one thing carries to the next, right? And then you have to decide, is that how I want this to continue to play out day to day? Right. And so, no, it sounds like you're wanting to say, no, I want to make a change. So that change has to start with you. Because in life, the only person that we really can impact and change is self. Right. And so there has to be some self-work. And so that's where it's like, this is not a quick fix. This is something that in doing it, you're going to go back. Like when we're upset with our patients because they haven't followed through, they're just going back to their default, right? We go back to our default, what's comfortable, what's normal, right? But you be mindful, you will catch yourself and say, no, I'm not going to hold negative judgment on myself for how this interaction went. I'm going to acknowledge objectively, right? We're physical therapists. We should be able to really objectively look at the pros, the cons, the plus, the minuses, how it played out, everybody's role in it, in any situation, and say, okay, I see what happened. That is absolutely not how I wanted to respond. You know, I did not want to be snippy. I didn't want to, you know, go tit for tat, right? I didn't want to do that, but guess what? It happened.
Yeah.
And so you have to say, okay, could I have taken a breath before I opened my mouth to respond? Was it going to be 3 breaths that were needed, right?
I'm feeling like 12 years of
somebody
parenting are flashing before my eyes right now. Like the last 12 years of my
It's a
parenting. Should I
lifestyle.
have taken a breath? Yes, I should have. Should I have waited a beat? Yes, I should have. You know, were my expectations not where they should have been? Did I give even my kids like the benefit of the doubt of like a blank slate place to start? Was I mindful of what their experience was?
Right. And so it goes into every aspect of your life, right? So then if that becomes who you are, then you will implement it in different settings. And it's a work in progress. And when you aren't successful, you don't beat yourself down about it, because we're humans, right? We're not perfect.
What?
You're still learning on this journey, right? We're not perfect. Do I need to say that again?
Man.
We want to do everything right. It's not going to happen. And I think taking that pressure off yourself and say, you know, I'm going to make a mistake, but what will I learn from it? It's going to teach me something. Sometimes the best lessons we learn is when we hit hard and we're like, oh, that was embarrassing. Ooh, that was ugly. I don't want to do that again, right? And so understanding that that's part of this process. So some of what I think about and how I live my life is mindfulness, growth mindset, it's kindness, all of these things that we don't have enough of and we don't see enough of. And once again, it starts with self, right? So you have to be kind to yourself. And no, I'm not perfect. So that didn't go the way I wanted it to. I have to let that go. And how do I let that go? Let me focus on my breathing. Let me take a body scan. There are lots of different mindfulness exercises that you can do to say, okay, right now I need to check in with myself. Let me do a body scan as I take these deep breaths in and out. And as I focus on my breathing, what are the sensations I'm feeling? Where do I feel any tension in my body? Start at my head, go to my feet. Now, this is a really sped up version of a body scan, but that's kind of what it is. It's really checking in with self to say, you know what, these shoulders are kind of high right now because this is where this tension is. And then you stay there for a little bit and take some deep breaths and say, okay, with every exhale, I want to help release and relax this tension wherever it is in your body. It could be in your hands, like, ooh, I got these fists balled up, I'm ready to go. Maybe it's in your feet, like you're ready to run. That fight or flight is a real thing.
Well, especially for patients in the emergency department, right? Like that's where they are.
Yeah, so all of that, so these different types of exercises can kind of help you to say, let me check in with self, let me learn how to focus on my breathing as I'm talking to somebody, right? So if I'm overwhelmed, like I know meeting someone new is going to stress me out, I need to do my self work before. Let me take some deep breaths. As I step in here, let me share my intention without words, through my body language, that I want to connect with you and understand what's going on. And just that in itself sometimes can be the difference of someone just being like, I will share and just dump everything in front of you because they just feel that connection. And then there are times where people have a wall and they don't want to, and that's okay too, because how has their trauma led them to this point in time and made them who they are? I'm not even mad if you don't trust me, because I get that you have been harmed, right? So who am I to expect that it has to turn around because I just decided to be mindful one day, right? So with all of that, no matter what it is, you have to be ready for these possibilities that it could go great, it could go poorly, and you got to try what you know to try. If you're successful, great. If you're not, in both situations, you're going to be able to learn something from it if you take time to reflect.
Yeah. I mean, I don't even know what to say to that. That's like such good learning, but it will take a while. Like you can't just become excellent at this overnight, right? Like this is a
No,
work.
we are all a work. I am a work in progress.
It's
My
like a
kids will,
plank.
right. Yes, my kids will be like, Mom, are you tired? Are you cranky? What's going on with you? Do you need to take a deep breath? You know what? Thank you for bringing that to my awareness. I do, right? So
Mm,
I am not perfect. I am not always where I want to be, but there are times where I have success and I'm like, okay, cool. Let me continue that. Whatever that was I did, I got to do more of that because that was helpful. I have to identify when I'm tired, I'm not my best self. So let me recharge because that's going to be for everybody's benefit.
right.
And so those things you learn along the way and be okay with trying and failing and trying again, right? Sometimes we have to unlearn the things that we've learned or we thought would be successful to have better progress.
How would you implement this in a team? Because when what you just said there, like with your children, like checking in with you, how do you set that up in a team where you can like gently call each other out, but like in a supportive way? Like, is there a way to like teach this in a team setting so I can say to you, like, Mica, I feel like maybe before you go into this next room, we should take some deep breaths together? Or do you have things you want to say about your last patient encounter? Like what are good ways to support a team through this?
I think those are some great ideas that you just had. It starts with the education and the understanding of this. It starts with the intentions of um, how we want to function as a team, right? So some of this
Mm,
is bonding, goal setting, identifying, where we go back to and knowing who we are as an individual. You got to know that about your organization and your team. So who is this that we want to be? What type of care do we want to provide? How do we want to support each other, right? And so no judgment if you don't want somebody to come and check you, because there are people that was like, don't come for
yeah,
me, don't,
don't, yeah.
right? And so
Especially
cool.
in the emergency department, I actually could see that being a real thing because I feel
Yeah,
like if I went up to like a physician and I was like, I just feel like you need to take a couple deep breaths, like they
right.
would be like, maybe perhaps use some very professional abrasive language, like you need to get out of my way because I have 50
Right.
patients waiting for me. Like
Right. And so
how do you do
so
that?
it has to be a culture thing, right? And
Mm,
collectively, when decisions and when culture shifts is because everybody is on board from the top to the bottom, right?
uh,
But if that's not the case, and even if you try and bring like, hey, you know what, I've learned that mindfulness is great for teams or things like that, even if the uptake isn't there, you still can do it for yourself, right? You still can check in with self. And I think that's something that we have to be okay with is everybody's not always going to be as excited about the things that you are at that moment in time. And with that, you have to decide like, okay, but what is my commitment going to be? What is it that I still want to do, even if this is not collectively where people want to be?
or maybe they just don't know
Yeah. And so
that
you then
that's where
become
they're
the
not
example.
aware that it's
And
an
then you
option.
become the example.
Okay, I love that. So this is kind of a loaded question. Burnout. If you have somebody who they like are self-professed like burned out and feel like they cannot come back from that, where would you suggest that person start in trying to find their way back?
I think if an individual has identified that they are at a point beyond return, then there is other mental health services that they really should be seeking out. If that's something that maybe they aren't ready for in that moment, that still is something that should be offered and encouraged. Sometimes we just have to remove this stigma of, I don't want to take advantage of this service, whatever it is. It's like, no, like this absolutely is helpful.
Right.
Talk to a therapist, talk to a counselor. A lot of jobs offer those services to say, you know what, this could be really beneficial to you. So I think starting there and just supporting an individual where they are, if it's mindfulness that they're like, you know what, I'm not ready to go talk to somebody, but I would like to learn a little bit more about this. There are lots of apps and websites, and they can reach out to me if they have questions, just to see like if you want to take baby steps, if you want to jump head first, feet first and not head first, jumping in feet first to say, I want to give this 100%. Like there are many ways that you absolutely can give this a try.
I love that. Okay. Because we always finish with a case. I have a case for you of a time when I was mindful too late. And in the end, it kind of saved the day, but I want you to think from your expert perspective, like how this could have like been completely different. So I had a busy day and it was like 2 o'clock in the afternoon, like no time for break, no time for lunch, like jamming, have lots of patients waiting, have a young patient come in with acute shoulder pain and like so much pain, right? Like, but he's been given Tylenol, ibuprofen, because we don't really give anything stronger than that most of the time. And I'm working with this patient and he's so uncomfortable and I'm trying to like figure it out. Like I want to know the answer. And I'm going to do every special test that has been given to us under this blessed physical therapy umbrella of special testiness. And I'm hurting the patient. Like literally, like in hindsight, after that reflective period, like I am not making him better. I am making him suffer as we go through this because I really want to be able to tell the patient what's wrong with them. And I want to be able to treat them the best way. And I want to be able to be the one that helped them. But I'm also tired and stressed and hungry and maybe not going through it the best that I can. And so in that moment, I just took a step back and I said, hey, like, I'm going to see what we can do about your pain control. I'm going to ask for help from my team about controlling your pain. And I'm going to give that some time and then I'm going to come back. And I just walked away and I felt so weird about that. And then I asked the team if they could help that patient pharmacologically in some way because I had clearly exacerbated his unstable, irritable, highly acute symptoms, which I usually do not do. And then I went and had lunch. And while I was at lunch, I called a colleague and I said, what am I missing? Like, these are the tests that I've done. These are the things that I've done. Like, I cannot figure it out. And I got this perspective that I needed to think about how I was going to intervene. And would having the answer change how I was going to manage the patient right now? And the answer was no, right? Like we're in symptom modulation time. Like the answer was I was going to try and make his pain as better as possible and educate him on next steps and ways to kind of self-manage so that he wasn't still in a crisis. Was I going to do like rows or like, no. Like what I needed to figure out was, does he need imaging? Does he need a sling to protect him when he leaves here? Is his joint stable? Like, what are the things that I need to know? And I took some time and I took some deep breaths. And then I went back into the room and I said to the patient, here's the thing. I thought about this while I was eating lunch. And I want to apologize to you for putting you through all of that, because I just really wanted to tell you the answer. And the patient, with all the grace ever, said, I really wanted you to tell me the answer too, which is why I was agreeable to that. And I said, but here's the thing, I don't think knowing the answer today is going to help either of us. And you won't feel better. And so what I'd like to do are try these things to help decrease your pain. And then I'm going to refer you to the right people to continue to help find that answer that you feel like you need. And just like the whole room changed, right? Like the patient relaxed. I was able to touch them much more freely. I was able to let go of the fact that I had to be right and I had to solve the problem. And I had to be the one to fix this moment for him. But I have to tell you, like, I'm ashamed at how long it took me. And it affected me for the rest of the day. But when you talk about like that checking in process, I did not do that. I was rushed. I wanted him fixed fast so I could maybe get a bite to eat. I wanted a break. I wanted to get my job done efficiently, quickly, and successfully
Mhm.
at the cost of the person in front of me.
Yeah. Yeah. I mean, you unraveled that, but I think sometimes you have to have that experience so that the next time it will be different. And
Right.
that's where that we're not going to hold on to those emotions of I'm really upset about how long it took me, because that needed to happen.
Mm,
You needed to experience that, like, oh, if I think I'm going to be the solution and I'm going to be the answer, and so everything is driving the weight, the pressure of
mm.
I have to be this that has to come from me. How does that affect you in then the pressure that is on you to provide this intervention versus, when you truly are collaborative with your patient and honest? I think that vulnerability is really what probably shifted that relationship.
I
um,
agree because I didn't harm the patient. I don't mean for it to sound like that, but I gave him an experience that was not pleasant.
Mhm.
But in the end, his patient satisfaction was the highest on the scale when we give him the patient satisfaction survey. And the comments that he wrote were very positive. And that didn't help me though. Like that made me feel almost worse. Um, because I was still being so judgmental of myself and how that interaction went. Whereas the patient was like, that's what they needed. They needed to hear from me that we wouldn't maybe find the answer and that was okay. And
Yeah,
that it was okay.
that way. If you start, what is start with the goal. What is it that we're trying to accomplish here? Figure out what the patient's expectations are and where you feel like you're where you want to be, and you kind of have to be led by them. Like, I just don't want to be in pain. Yeah, I might want to know what's going on, but if you could just help me manage this pain,
100%.
and then put me in the hands of this next step, right? Because I would imagine in the ED, it's not that you're going to be there. We don't want you there for
Mm-mm.
more than some hours, right?
And
We
we
don't
never want to see you again, really.
for the
Like
day.
ideally, you're
We
going to
want
hit
you
the
to
door and we'll
find
never see you again.
right. We want to connect you, and like, it just sounds like a beautiful community setup if it's done right. Like, let me now refer you to this next person that I believe is going to help you, and if they can't, I know that they're going to send you, and direct your care in an appropriate way.
Oh, man, that self-reflection and the non-judgmental part is hard.
It's
But I think
hard,
that
and a lot of
processing
people don't
helped
want to
me
do
and the
that.
patient.
Yeah. And a lot of people don't want to do that because that may be where there's some pain, right? And it goes back
Mm,
to, you're not perfect, you're not going to be perfect, and really being able to accept that. I think as a profession, as PT professionals, we want to be the answer giver. We want to be the source of knowledge and all knowing, but if we can be honest with, we be okay with saying, I'm not sure, I don't know, I will get back to you, I will look it up, I will find out, I will collaborate with, I will check in with somebody else. The more you say that, it then becomes part of, like, this is that community, this is that collective that actually is going to help us to get to a better solution than if I feel and carry this burden that I have to be the source of the solution.
My motto for being a physical therapist is to be a hope bringer. I want
Mm.
to be the one that gives you hope about whatever the situation is. And I think in the end, I was true to my purpose. Um, but yeah, I think for me, that was an example of when mindfulness really like helped sort of save the day.
Beautiful. And it doesn't matter how long it takes, you got there.
Life is forever tries, right? Try
Yes.
again and
And we
again and
don't,
again.
it's not over till we win. So we just keep working on it.
I love it. So, Dr. Mitchell, if people are like, gosh, this is amazing, how can I learn more about this? How can they get in touch with you for either like group classes, training, or individual work?
So yes, there is a website, thecreativelymeek.com. And I am on social media, Instagram and Twitter and Facebook, Creatively Meek. That is my company, my business, my place to be. Just explore creativity. We're stepping back from everything regimented and structured and just seeing like where we want to go, and being a mindfulness guide. So reaching out in those capacities, there's contact information on the website and then social media to connect. And there will be more information and opportunities to collaborate in the future. So I'm excited about that. Just being able to share mindfulness with others, provide group facilitations, maybe even one-on-one guidance. As your mindfulness guide, I can do that one-on-one as well.
I love that. Okay, well, I thank you so much for your time today and for sharing your expertise. I really hope that this benefited many providers in the emergency department.
I appreciate the invitation.
Well, thank you all for tuning in for our most recent episode. I hope you'll like, subscribe, and share, and we'll see you next time on Admitted or Not.